Good evening and welcome to another episode of Fresh Natural Live. We are coming to you live. We have been off for several weeks for various reasons. I've been busy working on a project that we'll talk about later in the show. And so we had some recorded shows. And of course, we were off 1 week. We got one little ding by the powers that be, but that's okay. We're back and we have a very, very interesting topic tonight. We're going to be talking about thermal imaging, and how it can be used to detect inflammation. So this is a very, very important topic because most of us are taught to get screening tests such as, colonoscopies and mammograms and the like, x-rays maybe. There are some tools and technology that can help us detect earlier signs of disease states. And I think it's very important for us to understand this concept. And we're going to bring this to you tonight. So get your pen and paper ready. We have another exciting show for you tonight as usual. Okay, welcome back. So as I said, we're going to be talking about thermal energy imaging. I keep wanting to say thermal imaging, and how it can help us detect inflammation very early. And inflammation is an early sign of disease states. And so I'm very pleased to have my friend and colleague, Dr. Pam Atkins, who's going to be leading this discussion tonight. Dr. Atkins, how are you doing?
I'm doing well. Good evening. Hello. Happy to see everyone here and to be here and talk about something I'm passionate about.
Yeah, happy to be back live for once in a while.
Yes.
It's been a while. And of course, your partner in crime, Dr. Floyd Atkins. Hello, sir. How's it going?
I'm doing wonderful. How are you doing today?
Just fine. And so thermal imaging, we've had some conversations about this before, Dr. Atkins, and, you've developed an expertise in this. I know you do lots of reading and evaluating patients with this technology. I'm going to let you take over the discussion, and I'm going to bring up your slides here. But, to get us started, what is thermal imaging? Excuse me. I want to say imaging, and what, kind of get us going with an overview and as you get into your slides here.
Yes. Okay. Thank you. Yeah. Thermal imaging is something that is a screening tool, and not everyone has heard about it. And usually in conventional medicine, doctors are not exposed to it. And I wasn't exposed to it in my training, but we may have been exposed to it first in movies in the 80s, a movie like The Predator, when they used those heat sensitive cameras to detect live bodies moving or creatures, and with the warmer images. So some of us remember that, and bringing it down to more of the present time, screening at the airports when there was H1N1 and now coronavirus. Some airports were screening for inflammatory changes, particularly in the face and sinuses and fever. Fever is a sign of inflammation. And so that was a screening tool for that. And so digital thermography detects the physiological changes that are related to the sympathetic nerve control of the skin. And we are looking at the different temperature patterns on the skin that may suggest something is going on deeper in the body. And thermography was something that I came across because I was looking for something not just for my patients, but for myself. And in screening, for example, screening the breast, in addition to mammogram, what could we be doing to find things earlier than a density on mammogram? Because that can be a later finding, but we want to find early changes. So digital infrared thermography, sometimes people abbreviate it DITI, is non-invasive, it's painless, it doesn't have any pressure, actually doesn't touch the skin, and it's non-radiation screening procedure. It is a great tool that can help your doctors identify if there's some inflammation in an area and vascular changes. Although a lot of doctors are not familiar with it. And so I've been doing thermography in my practice since 2004, and I have been reading thermographies all over the country and sometimes out of the country. Images from out of the country are sent to me since 2007. So we can, a lot of people have associated with thermography with the breast, but I want to highlight first some of the non-breast areas that we can use for screening. Number one, cardiovascular screening, when we're looking at the carotid arteries, which are more superficial. When we're looking at thermography screenings, we're looking for pattern, temperature differences. Inflammation is warmer, vascular is warmer. Cooler could be some dysfunction of tissue. And so cooler can mean something too. And we're looking for asymmetrical. So, we have two sides of our body. So if we see one side of the body warmer than the other, than the carotid areas, this is more suspicious of some inflammatory change. It may not be occlusion, but inflammatory changes, because many times thermography patterns are found earlier than if there's occlusion or blockage. And go ahead.
So I guess with the carotid arteries, I don't know if they look at coronary arteries, but have there any studies look at data of increased thermographic heat patterns with stroke or acute coronary syndromes?
Yeah, well, I mean, with the coronary arteries, we don't specifically see the patterns because they're deeper, but what we do see it's a more general screening, but in the heart area, if we see a blue concentrated area on the left side, usually it's somewhat above the breast. It's not right, on the breast, but a little bit higher, but a kind of blue lake there, as opposed to the right side, more suspicious of tissue dysfunction in the heart area. So it could suggest congestive heart failure or a previous history of a myocardial infarct.
Gotcha.
Okay. And this on the screen, we're screening the thyroid area, and this area, go back to it. So the thyroid area, and you see the two red areas, or orangish red area. The hottest is white in thermography, then red, orange, yellow getting cooler, and blue-green is pretty cool, and kind of purple is very cool. So you see those warm areas on two sides, and that could coincide with the thyroid, and so that may show some inflammation there in the thyroid area. So that would be something to have your doctor do more screening on.
Gotcha.
When we look at the extremity, we can see different things, and this area where when you see folds in the skin, you're going to see warm, where skin touches skin. And so that's not unusual, but we see this vascular pattern here. And this could be, or usually is, a varicosity, varicose veins. And some people have some chronic pain that the doctor is trying to identify, and not always is it easy to identify that the varicose veins are causing the pain. But that is what this person has, a significant varicose vein. So, and these are different images of the upper back and the neck area. This person it has some asymmetrical acute inflammation. You see these white areas, warm areas, more on the left side, muscular skeletal than the right. It could have been from an injury or something, but this person probably has more symptoms on the left, a little bit over the thoracic spine as well. And you see the two at on the other sides are not as acute. This one is a little warmer than this one, but these are just muscular tension of the upper back, the trapezius and the trapezius and the rhomboids, the supraspinatus, and those muscles. Many times this is where we hold our tension, and many times we're at a computer or reading, and we don't realize we tense up these muscles and hold a lot of tension there. Usually if we see a cooler area in this area over the upper thoracic spine, usually the T2 area, sometimes it's like this with warmth around it and cooler in the area, may be suggestive of immune dysfunction, a risk for autoimmune disease, chronic fatigue syndrome, fibromyalgia. We're screening for that. Would recommend that. And this is some inflammation of the thoracic spine.
Gotcha.
So we're seeing inflammation all over the body.
The guy with the white spots in the previous one in his back, what might that? He's got like several white, really hot spots. Is this like maybe a skin infection or something, or it could be something in the lungs, or?
These are focal inflammatory areas. So usually it's musculoskeletal. It could have been like a car accident or injury or a fall or something like that. I would think something more acute in nature. Yes.
Gotcha. Okay.
Yeah, but the history is always helpful, when we do this, to have some history on the patient. Let me go the other way. All right. So this gentleman, as you see, has eyes area, but you see this area that's blue and very cool. So it shows some tissue dysfunction, and this person from the history has a history of Bell's palsy, more of a neuromuscular dysfunction, and it's very obvious it's on his left side of his face. Even with the extremities, we can see different things. This is evidence of a stress fracture on a football player. Many times stress fractures initially, because they're not wide open, that many times are missed on x-ray. But this person had a persistent linear pattern there. And sometimes when they repeat if they continue to have swelling and pain and they repeat the x-ray in, a couple of weeks, usually it opens up and it shows a fracture.
Gotcha.
Yeah. And this is an interesting study from acupuncturists doing acupuncture treatment. They're showing sequential decreased inflammation here in intervals after having acupuncture treatments. And eventually you see the warmth, the redness acutely decrease. So inflammation is usually redness, warmth, pain, sometimes swelling, all signs of inflammation. And this is an ankle area. This is a person that had a cast for ankle injury, and once it was removed, it showed that still had some poor healing there. That still had quite a bit of inflammation. So that was interesting to see. On this one, you see this person had a history of a right ankle fracture, but what we see many times when we have problems on one side, we put more pressure on the other side, or postural pressure. So with weight transfer, had more warmth and inflammation on that dominant side. And I've seen that with people with knee injuries. This has a little coolness on the knee, may suggest some dysfunction in the knee, or if you see a lot of warmth, inflammation. But with knee injuries, sometimes we rely on the other side, and eventually we wear down the good side by putting more pressure on it. All right, and this is post-surgical knee arthroscopic evaluation, and it just shows the inflammation after going in with the scope and having arthroscopic type of procedure. This is something you see the difference, the coolness on this foot compared to the some warm patterns on this foot, and this is reflex sympathetic dystrophy, a neurological change, sometimes post-traumatic, but it's characterized by that coolness on that affected side. And this is the suggestion of neuromuscular changes and cutaneous changes of the right hand coolness here, as opposed to here. This is more of what we would expect. So there's some nerve changes or dysfunction going on in these fingers with this patient. So as I say, it's a screening technique. Even carpal tunnel, we can see this person had some dysfunction, so some coolness on this side, kind of warmth on this thumb here. And then, or carpal tunnel could look this way if someone has it on both sides and some focal points of inflammation. So let's see. And this is a person that had a motor vehicle accident, and the steering wheel traumatized the chest area. And with the x-ray, it was revealed that the person had a fracture of the sternum and a fracture of the left rib here. And so you see the marked warmth and inflammation on that side, asymmetrical. And going to the abdominal area, we can find some things in the abdomen that can give us some clues. This is the umbilicus or the belly button. We expect to be warmth there where there's skin kind of coming close contact with skin. But here there's some inflammation of the upper colon, the right, the ascending colon on the right going up to the hepatic flexure. There was some warmth here, but this patient actually had back pain, and when they did the thermography, because nothing was seen on x-ray, they found out there was inflammation of the kidney area, and they saw the most inflammation actually from the front. Sometimes you'll see it from the back, on the back view. And so this person had a kidney infection. That's inflammation too. This person has more of the warmth in that ascending colon area going towards the liver, and had some inflammation as well in that colon area. So, I mean, many times it gives us an indication we may need to eliminate better, you know, eat more fiber and things of that nature.
One breast is bluer than the other. Any indication there?
Oh, yes. Yeah, I did see that. Yes. And that's another thing, the coolness on one side than the other. That usually what that suggests is maybe more inflammation on the warmer side, although the cooler side's contraction. But also, if you see more of that deep blue in this area, could be cardiac, you know, cardiac dysfunction.
Gotcha.
And so I wanted to show a little bit about breast, because that's what many people may know thermography for, and I didn't want to leave that out. But the screening, you do have to remove your clothes to do the screening, but there's no touching or pressing of the breast, as I said. And we're looking for the temperature changes. So you don't want to touch your body or jog into the for the exam and you're hot and sweaty, you know, but and you don't want to drink a cool drink right before you do it, or a hot drink, because that could affect your temperature. But thermography for breast can be helpful for fibrocystic dense breast that many women have, and it's considered benign, but chronic fibrocystic breast can increase the risk for having breast density and breast cancer, because it's a sign of estrogen dominance. So we want to be aware of that. Implants can be screened on thermography. We do it all the time. The good thing, there's no pressing, so no risk in rupturing the implants. And you're looking for temperature changes, and you're looking for vascular changes with the implant. And the family history of breast cancer, many women have family history of breast cancer and want to screen earlier, then maybe their doctor recommends them to have a mammogram. Many OBGYNs are recommending mammograms by 40. And if there's no specific family history, women have waited by 50, and definitely they want it by 50. But we know that aggressive breast cancers are in younger women that are perimenopausal or premenopausal, and so that have more hormones and estrogens. So that's a good screening tool. Also, women of all ages, but particularly below 50 is more concerned because it's more aggressive. And in addition for men as well, because men can get breast cancer. They say approximately 1% of male population in the United States, incidence about 2,300 cases per year. And so we do screening of the chest area, the mammary tissue of men.
Willie Keys asked an interesting question. Could the dark blue also mean low blood flow as well? So you mentioned dysfunction. Is that the mechanism for blood flow associated with that dysfunction, either in that breast that we talk about or the guy with Bell's palsy?
Yeah, those cooler, bluer areas can, you want that can be less vascular flow, but what we usually are concerned about to see blood vessel patterns around a cooler area, almost like a donut or surrounding it or a loop, that can be more suspicious of an inner mass or density that's being fed by blood vessels around it. But we do see sometimes with injury, if a person has had some past injury and scar tissue, they may see more blueness on one side or other than the other.
Gotcha. Great.
Okay. So thermography was approved by FDA in 1982 as an adjunct for breast cancer screening. So in addition to ultrasound, mammogram, and occasionally women are referred for MRIs, this can be a radiographic way to do a screening, but it is considered an adjunct. And it's important, to know for the younger women before 40, it can help identify multiplying cells that could be increasing the risk for a tumor or a density. It takes on average 8 years for a density to appear on the mammogram, but thermography can see significant or suspicious changes earlier. And sometimes when patients go to get a mammogram and something was seen on thermography and the mammogram's negative, patients are relieved and may not come back for a year or two for thermography. But, we really encourage them to follow up because it is an early sign. So usually we do one repeated in 3 months, and depending on the findings, may say come back in 6 months to a year, or if we're following closely, 3 months. So again, they're talking about dense breast tissue in women and how it can be helpful.
Question about the cost of thermal imaging, and does insurance cover it?
No, insurance really, we haven't seen it cover very well, so don't have a track record with that. Many times, a breast screening can be $200 or slightly less. It's not extremely expensive. If you want to do upper body with abdomen, it's a little bit more, but it is not usually as expensive as MRIs and some other more advanced imaging. This is just showing fibrocystic changes, and so this is on the left side is you see the orange and chain kind of bilateral, but symmetrical orange changes are fairly symmetrical. This is more of a 5 or 6 week change with some estrogen dominance. And so this is the person later with less estrogen dominance, some intervention with diet and hormone balancing, things of that nature. I do see a blue area in the thymus area, and that can suggest some immune dysfunction, that the immune system needs to be strengthened and to improve that. But that's more.
Seems like some of that cleared up also in the neck area.
Yeah. Yes, it did. And
this overlay with the breast tissue is just, like you said, skin fold. So this.
Yes, and you'll see that warm, hot area where skin is touching skin, and that is not alarming. We want to let you know that. Now, this is very dramatic, because you see the right breast clearly has a lot of inflammation, warmth, and more warmth toward the areola area. And this is actually what inflammatory breast cancer looks like, which sometimes is mistaken for a breast infection, and on mammogram is usually not seen. But it shows up on thermography quite significantly. So that is inflammatory breast cancer, what it looks like. And this is just showing a person that had initial thermography, and they had some warm asymmetry on this right side. And they were told to come back in 3 months and check with their doctor. They came back in 3 months, and it seemed to be getting a little hotter. So the patient went and got a mammogram, and the mammogram was inconclusive. But they were told to come back in a year for the mammogram. But in the meantime, the patient kept screening with thermography, and it as you see, it increased and was eventually diagnosed by time of the 12 months with biopsy was recommended. I guess the mammogram was finally showing some kind of density, and this person was diagnosed with breast cancer.
This is before 12 months.
So yes, the detoxification and dietary changes and removal of pesticides and organic and decreasing body fat and infrared sauna and sweating, all these things can help. You're right. And so there's a lot we can do.
Yeah.
And this person was suspicious for breast cancer. When you see kind of a donut and it's not as hot in the center, that's more very suspicious. So I just wanted to speak briefly that the doubling time for tumor cells, the younger that women are, because there's more estrogen, more hormones, usually under 50 may have a doubling time as fast as 80 days. But you see, for women 50 to 70, it goes up to 157 days, and over 70, 188 days. So a lot of times women that are younger, in their 20s, 30s, and 40s, are not thinking about breast cancer, but this is the time where it can be very aggressive, if found. So we want to do our preventive measures, even for the young people. So, and this is another doubling chart that this chart averaged about 90 days, and said from 2 cells, how in 4 years the cells can multiply to 65,000 cells. And this, all the black is before anything's detectable on a mammogram. So we can do thermography at all those times, and we can see images like this long before, many times long before a density seen on mammogram. So don't just stop with the mammogram. And this just want a reminder to our men that there's male breast cancer, and so we need to be aware of that. And we look at asymmetrical vascular patterns, warmth, and you see a little loop or donut here, and this vascular pattern feeding it. So this is male breast cancer. I think, as we say, those detoxification measures and sweating and infrared and the diet, plant-based diet without meat, reduce or take away the meat, and definitely with pesticides and xenoestrogens and things like that can be helpful for men and women.